The Globe and Mail calls community health centers the best kept secret in the healthcare system, and the kind of healthcare we practice has been described as an ideal model for the future. Every minute of every day, Ontario's 54 community health centers and 10 Aboriginal health access centers use an interdisciplinary approach to provide primary health care. At the core of our success is the interdisciplinary care and our collaborative practice model. And we'd like to tell you more about how we put this into action for the benefit of our clients, patients, and communities.
The clients are the center of it. It is client-focused, and then deciding on from that basis, you look at the client, and the needs are wrapped around them. And in some cases, they actually even call it wraparound services, but they're the very heart of it. So interdisciplinary care is client-focused care. They're synonymous.
It is a model that brings together a range of health providers, health promotion staff, human services staff, to work collectively as a team, to work collectively with a community in a mutual relationship to support health, to improve health, to address illness, to address chronic health conditions, and to respond to a unique community.
Interdisciplinary teamwork contributes to the strengthening of the whole person and the communities in which they live. For Ontario's 10 Aboriginal health access centres, interdisciplinary care is represented by the medicine wheel with the client at the centre.
Health means the mental, the emotional, the physical, and the spiritual. That all of those things must be in balance in an individual to say that they actually walk that good life. So for us at Wabano, it's absolutely fundamental that those pieces of that individual must be looked at as a whole, and hence the holistic integrated care that is given here.
Inside the centres or outside, we reach people with our interdisciplinary teams wherever they are required.
This is our nurse practitioner. Down treating our client down there also is our mental health worker and our youth worker. We have our grandmother, our program grandmother, she provides cultural support to our clients. We have this individual down the hill who has a broken leg. He's been walking on it for the last week and a half, and we're trying to impress on him how important it is for him to get treated. But he won't get it treated because of the fear that will leave him vulnerable, wearing a cast and having to use crutches.
So I was able to have a look at his foot and make sure that the circulation was okay, which it was. And then the next step was to try and convince him of why he needed to go to the hospital, which he wasn't interested in. So what we're now in the process of doing is connecting with some other services in the city, and there are people that can go out and look for him and take care of him that way.
Connecting and building partnerships with other community services is an important feature for all centres.
Community is interdisciplinary by nature, and we go outside to do things that belong to the community. So the partnerships that we strike, the partnerships that we become involved in, the initiatives that we lead are rarely done in isolation, because the impact is going to be felt out there, and so the information that we need to do the planning needs to be out there.
The health promoter's role is actually engaging the community, going out to the community to do work, because we believe that health is just not just the absence of being sick, it's also like the well-being of being able to feel that you belong to the community, and all your health needs, including your psychosocial needs, are being looked after. That's why the health promoter's role is actually like going out to the community, finding out what they want, and then bring the information back to the health center to discuss with the interdisciplinary team.
The Gesundheit für Kinder program in St. Jacobs is an example of health promotion, community outreach staff, and all providers working collaboratively to ensure that the appropriate services are wrapped around the client. Whether it's a large urban centre or a rural centre such as St. Jacobs, health promoters and community outreach staff have a vital role to play.
When we started this program, children were very shy. They wouldn't leave their mother's skirt tails, and mothers were afraid to leave the children. They're in a brand new country, they don't speak the language, they're tired, they're fatigued. It's been wonderful to watch over the years how the children are now enthusiastically running to their program.
I can say that the peer workers that we've nurtured, that we've brought sort of into the program, and they help us to communicate with the women, but we've also helped them to grow and to really feel a part of the community.
Mothers are much more vocal in the group programs. They're ready to talk with each other, and they're even starting to make jokes, which is something brand new.
Interdisciplinary care means connecting individuals in the community to the services they need. Communication is a key feature of good interdisciplinary practice.
Communication is critical in making sure that the interdisciplinary team is able to function effectively and efficiently. And in order to have that happen, you do need to make sure that there is planned, scheduled time to allow that kind of interaction to take place. It is the most meaningful and effective way of doing that, and the impact of it with the clients is tremendous.
For chronic disease management, these communication structures contribute to strong health outcomes. That's important because Ontario is facing increasing challenges meeting the needs of people with chronic diseases such as diabetes, cardiovascular disease, asthma, and arthritis. Diverse teams enable CHCs to provide monitoring, assessment, treatment, follow-up, education, and prevention to meet the needs of those affected by chronic diseases.
We meet quarterly with the team, and we do go through all our clients with diabetes. We have all their charts there, we have all their lab work on a flow sheet. So we look at those and we review every client to see whether they've had the lab work that was recommended done, whether they've seen the chiropodist once a year, how their care is managed, and then we send follow-up notes to people if they need to come in and see us. By having the team, by having the regular follow-up, people have the best advantage in preventing the complications and the expensive health care of bypass surgeries and heart attacks.
Chronic disease management has been a focus of our clinical team and our community outreach team for the last 3 or 4 years. We've, this past year, had an emphasis on osteoporosis. We've done some programming with our community outreach workers and our traditional programs in the center, our older adults program and our early years program, to teach people about osteoporosis. We've also done a significant amount of work with people with high cholesterol, with hypertension and diabetes in terms of not only group work, but with individual monitoring and follow-up. That's one of the really exciting things about the nurse practitioner role here, is we work collaboratively with the physicians to monitor these people with chronic illnesses. And this allows us as nurse practitioners to work to our full scope.
Part of the philosophy of community health centers is recognizing that a person's health is determined by many things other than just the obvious. And if we don't somehow try to address those things, we're going to miss the boat. If I only hand out prescriptions or I only assess the biological, then I'm really going to miss the bigger picture, and I'm likely going to miss a lot of what's going on in the background that actually has a huge influence on this person's life.
Serving 15 different languages in the center is a really great work that we do, and it makes the clients feel more comfortable, and it brings the clients to the center rather than us even doing a lot of the outreach outside. Once the word goes around, you know, the health centers have a better care, better languages, you know, providing 15 different languages is huge. And it captures their, you know, it captures their heart that we do care, that we do have their languages, and their health cares will be met no matter what with all these different languages.
We all know that there are many determinants of health, so clinical approach is only one small portion of it. We're talking about addressing all the other determinants of health. We're talking about addressing the housing needs. We're talking about addressing the income level needs and poverty and safety in a community. And to be able to do that, you have to be able to provide the services and take your ideology outside of the building, change the systems, change the structures of the government, change the way the decisions are made to be able to influence change overall.
As you've seen, interdisciplinary practices are at the heart of everything we do. Not-for-profit, community-governed health centers and their interdisciplinary models of care have proven themselves as centers of excellence, particularly for those facing barriers to access. We never rest. We are always in the process of refining our collaborative practice model. Over the next 3 years, 22 new community health centers and 16 satellites will be up and running. That's a good start, but thousands of Ontario residents will still be without the primary health care services they need. And interdisciplinary practice? Well, it may not become a buzzword, but it is a central feature of community health centers and Aboriginal health access centers. Our interdisciplinary model of care and the collaborative practices that go along with it are an important part of what makes us who we are. For the Association of Ontario Health Centers, I'm Bill Davidson.
I would recommend working in this environment, especially for dietitians. My colleagues who work in other healthcare settings are envious that I have access to this team, this amazing team of people, and that I have all of this information, all of these opportunities for follow-up.
I believe that of all the models of primary health care that are out there, the community health center model does that in a really unique way. And nurse practitioners moving into this model have the wonderful opportunity to look at primary health care in the broadest aspects of primary care. Not just the illness prevention, but health promotion and wellness care and capacity building within the community that really brings rich resources to communities to focus on wellness.
You cannot just provide singularly the physical piece, the high quality primary health care that in fact we all provide here. You must understand that there has to be something that links into the family, and the family must be engaged in this process, and that the greater community is also part of that person's journey. And there will be wellness. When a person is healthy, your community is also healthy. They go hand in hand.